heart disease. It is the leading cause of death in the U.S., and that's why doctors say knowing your risks to prevent a heart attack is crucial. WFMY News 2's Sydney Moore spoke with one Greensboro man whose family history increased his risk.
In November of 2022,
I felt very tired.
Mac Cheek was sound asleep in his bed.
It was 3 in the morning.
When suddenly a heart attack woke him up, forcing his wife to call 911.
They told my wife to get me to chew some aspirin. And then she called my daughter, who is a PA in the emergency room here.
Cheek was 65 years old at the time. He spent a total of 17 days at Cone Health's Heart and Vascular Center.
Luckily for us, 3 of the top cardiologists in the universe were here.
While the care was top-notch, Cheek spent the first 7 days in a coma.
I can remember crazy things that never happened. I told everybody my dog was in the room across the street wanting to across the room, hall, wanting to come in here and be with me.
The big question, how did this happen? Cheek says he has a family history of heart attacks.
My father died of a heart attack very young, 54.
He says he didn't know the importance of knowing your family history and taking a heart scan until it was too late.
The results said I was 99.9% sure to have a heart attack in the next year. And it happened in 10 days.
Dr. Manish Patwardhan is a cardiologist with Cone Health. He says on top of knowing your family history, there are other factors that can make you vulnerable to a heart attack.
Your blood pressure, cholesterol, smoking, lifestyle, exercise or lack thereof, diet.
He says age 50 is when at-risk groups can start seeing symptoms. The older a person is, the more at risk they are.
It could be chest heaviness, chest tightness, fullness, could be radiating to the jaw, sometimes associated with shortness of breath. These are the common symptoms.
After spending 17 days in the hospital,
I'd lost about 20 pounds just in that short a time.
Doctors advised Cheek to get put on medication, eat healthy, and exercise.
Yeah, because I always think that work is number one, and it ain't.
2 years later, he says he feels like $1 million.
I feel really good.
He's thankful for doctors at Cone Health who made him feel like family.
They took care of me like I was their own child.
A little TLC truly does go a long way. In Guilford County, Sydney Moore, WFMY News 2.
So as we just heard, knowing the signs of a heart attack and acting fast can save a life. And so we're hearing again from Dr. Manish Patwardhan with the Cone Health Heart Care, here to help us stay heart smart. To start with, let's just talk about those key signs of a heart attack that we should all know.
Absolutely. Thank you so much for having me on your show, Tanya. Heart disease is #1 killer in the United States, and it's very important for us to recognize those symptoms of heart attack. To remember, any chest pain, chest fullness, tightness, squeezing sensation may be associated with any dizziness or vomiting or shortness of breath. If any of these symptoms come on and last for more than 10 to 15 minutes, you should consider them very, very alarming for heart attack. Now, some patients of mine have said they had shortness of breath or uneasiness, not typical chest pain, but any of these symptoms occurring anywhere in upper part of your body, it could be radiating to jaw, radiating to arm, you should take them very, very seriously.
Yeah, don't just pass it off. Really pay attention to how long it's lasting and make sure that someone's around with you to call somebody. So what are some signs that people are commonly ignore, or maybe they misinterpret as something else that maybe they really shouldn't?
Yeah, absolutely. I'm very glad you asked that question. You know, some of my patients have told me they had indigestion symptoms. That's a very common symptom that patients misinterpret, especially holiday time. We're all indulging in some delicious food. Indigestion is a very common symptom that patients misattribute to. And you should, if you've not had any previous history of acid reflux and you have these sort of indigestion-like symptoms lasting for more than 15 minutes, and again, I said shortness of breath. Diabetic patients and women often have atypical symptoms of heart attack. So any shortness of breath, indigestion lasting for more than 15 minutes, don't take it lightly.
Okay, so let's just kind of put it out there for everyone. How dangerous is it to wait and see if the symptoms are just going to pass?
very important to know that time is muscle, as we call it in these situations. From the time your artery is blocked and causing a heart attack, the time is really ticking. For that time period when your heart muscle is not receiving blood flow, every minute counts. And the sooner you present to the hospital and sooner we get to open that blocked artery, it can really make a difference between life and death. So time is muscle. Don't waste time. If your symptoms last for 10-15 minutes, go ahead and take them seriously.
Okay, so there are definitely people at home that are like, well, I haven't had any of those kinds of symptoms or anything, and I'll get it checked out at some point in time. I don't, it's too busy right now. What would you tell them?
I get it. It's holiday time. Everybody's busy getting ready for the holidays. But, keep in mind, any heart attack can be life-threatening. Holidays will come again next year, but if it is a heart attack, you don't want to take it lightly.
So when you say you need to do something, if someone has those symptoms that you talked about, what should they do?
It is very important to pick up the phone and call 911 immediately when you are having these symptoms. Sometimes I've had patients who said their family would drive them to the hospital or they would drive themselves. It's important to keep in mind when heart attack is happening, it can lead to complications which could be life-threatening. And in those situations, it is not recommended for you to drive yourself or your family members to drive you. It is important you call 911 and have the EMS come and evaluate you and take you to the hospital. They are equipped to handle any emergency situations that can arise in the setting of heart attack. So it is very important that you call 911 and let the EMS take on from there onwards.
Yeah, you would hate for your family member to have to see you in some kind of condition and not know how to help you, where EMS absolutely does. Okay, we're going to take a quick break, but we're coming back to finish up our talk about heart disease and heart health and what you can do about it.